What if I told you that vision can be corrected through an incision smaller than 3 millimeters? No large flap, no lifting of the cornea, just a tiny opening that heals on its own within a few days. 20 years ago, this would have sounded like science fiction. Today, it is called Smile Pro, one of the most advanced technologies in laser vision correction. Most people have heard of LASIK. They know the word laser. But Smile Pro is still unfamiliar to many. And interestingly, this method is often especially attractive to people who are afraid of classic laser surgery, those who worry about a large flap movement, or a long recovery. Today, we will explain what Smile Pro is, how it differs from LASIK, who it is suitable for, and why anyone thinking about getting rid of glasses should know about it. SMILE stands for Small Incision Lenticle Extraction. It may sound complicated, but the idea is quite simple. In myopia or astigmatism, the cornea has a shape that causes light to focus incorrectly. To improve vision, the shape of the cornea must be changed by removing a precisely calculated amount of tissue. With LASIK, a flap is first created and lifted. Then, the laser reshapes the inner layers of the cornea. With Smile Pro, the process is different. A femtosecond laser creates a very thin lens-shaped layer inside the cornea. This layer is called a lenticule. Then the surgeon removes it through a tiny incision of only 2.3 millimeters. In simple words, with LASIK, it is like opening a lid, working inside, and closing it again. With Smile Pro, the lid is not opened. A small side opening is made, and the required tissue is removed through it. The surface of the cornea remains much more preserved. The main difference of Smile Pro is that there is no large flap. The word Pro means a newer generation of the technology. The laser works faster, and the lenticule is created in just a few seconds. This means the patient needs to fix their gaze for a shorter time, and the procedure feels more comfortable. Smile Pro also has improved centering and eye tracking systems. The device more accurately considers the position of the eye, tiny eye movements, and individual features of the cornea. This helps improve precision. So what advantages does this give the patient? First, the strength of the cornea is better preserved. Since no large flap is created, the surface layers remain more intact. Second, there is less impact on the corneal nerves. This is important because these nerves are involved in tear film function. That is why, after Smile Pro, the risk of noticeable dry eye is usually lower. Third, there are no flap-related risks. The flap cannot move after an eye injury because there is no flap at all. This makes the method especially interesting for athletes, active people, and those whose work involves physical activity. Fourth, the tiny incision heals quickly and usually does not require stitches. But it is important to understand that Smile Pro is not suitable for everyone. Most often, this method is used for myopia and astigmatism. It is usually considered for people over 18-20 years old whose vision has been stable for at least the last 1 to 2 years. The cornea must also have enough thickness and be healthy. This can only be checked during a full diagnostic examination. For hyperopia, other methods are usually used more often. If the cornea is too thin, if there is keratoconus, very high refractive error, or other eye conditions, Smile Pro may not be suitable. In such cases, the doctor may recommend femto-LASIK, ICL lenses, or another correction method. That is why the method should not be chosen based on advertising or someone else's advice. It should be chosen only after a complete eye examination. How does the procedure work? First, anesthetic eye drops are applied. No injections and no general anesthesia are needed. The patient remains awake and hears the surgeon. Then an eyelid holder is placed to keep the eye open. This is not painful. There may only be a light feeling of pressure. After that, the femtosecond laser creates the lenticule inside the cornea in just a few seconds. At this moment, the image may briefly become darker. This is normal. Then the surgeon carefully removes the lenticule through the small incision. Once it is removed, the shape of the cornea changes and light starts focusing correctly. The incision is so small that stitches are not needed. It heals on its own. There is no pain during the procedure because the eye is anesthetized. After the surgery, for several hours there may be mild burning, tearing, a foreign body sensation, or sensitivity to light. Usually, this period is quite mild. Vision begins to clear within the first hours. Many patients notice significant improvement on the first or second day. Final stabilization usually happens over the next few weeks. After surgery, it is important to follow the doctor's instructions. Do not rub your eyes. Use the prescribed eye drops. Avoid getting water in the eyes. Temporarily avoid swimming pools and saunas. Wear sunglasses and come to scheduled follow-up visits. Now let's discuss a few common myths. Myth number 1. Smile Pro is the same as LASIK, just with a new name. No, these are different technologies. LASIK creates a flap. Smile Pro performs correction through a small incision without creating a large flap. Myth number 2. If the technology is newer, it is always better. Not always. Smile Pro is a modern and powerful method, but it is not universal. The best method is the one that is suitable for your eye. Myth number 3. No flap means no surgery at all. No, it is still a surgical procedure, but with less impact on the surface of the cornea. It still requires preparation, an experienced surgeon, and proper recovery. Myth number 4. If I have high myopia, Smile Pro will definitely work for me. Not always. In very high degrees of myopia, other solutions may be needed, such as ICL lenses. Smile Pro is worth considering if you want to get rid of glasses or contact lenses, especially if you have an active lifestyle, play sports, or are prone to dry eyes. But everything starts not with choosing a technology, but with diagnostics. Only a full examination can show which method is best for you. Smile Pro, FemtoLASIK, ICL, or another option. Smile Pro is a modern laser vision correction technology with a small incision, fast recovery, and less impact on the eye surface. But there is no perfect method for everyone. There is only the method that is right for your eye. If you are thinking about laser vision correction and want to know whether Smile Pro is suitable for you, start with diagnostics. At Ko'z Nuri Clinic, we perform a complete preoperative examination, evaluate the condition and thickness of the cornea, check all necessary eye parameters, and honestly recommend the best method for your specific case. No pressure, only a professional evaluation. Contacts and appointment details are in the description below the video.